welcome to another video. So in today's video we'll be talking about depression. So depression is a common mental health condition that causes a person to feel persistently sad, hopeless, tired and disinterested in activities that they once enjoyed. So it goes beyond just normal sadness or emotional responses to life events. It usually affects the way the person thinks, the way the person feels, sleeps, eats. So it just affects the person's entire how they function entirely on a daily basis. So it is a medical condition, not a sign of weakness or laziness, and with proper treatment and support, most people with depression can recover fully. So depression affects people of all ages, genders and backgrounds, though it is more common in adolescent women and with those with chronic health problems. And there are different types of depression, including major depressive disorder, persistent major depressive disorder. This is when someone has a persistent low mood lasting for weeks or months. Then there's also another type known as persistent depressive disorder, which is a milder but long-term form lasting 2 years or more. Then there's postpartum depression, which occurs in some mothers after childbirth. Then there is seasonal depression, which worsens during certain times of the year, often in the rainy or the cold seasons or during the winter. So this is when we have like seasonal depressions. So because there are certain people that they don't like a particular time of the year based on the seasons, maybe it's too hot, it's too cold, so it can lead to all these mood swings and mood changes and depression. So there's also depression with psychotic features. So this involves hallucinations or delusions alongside with the depression. So for the causes and the risk factors, depression results from a combination of biological, psychological and social factors. So biological factors that can cause depression, like imbalance in brain chemicals like serotonin, dopamine and norepinephrine. Then also genetic vulnerability or family history, and hormonal changes like hormonal changes that occur in pregnancy or during menopause or thyroid disorders. Then for the psychological and environmental factors, we have prolonged stress or trauma, then childhood abuse or neglect, loss of a loved one, unemployment or poverty, chronic illness like if somebody has cancer or diabetes or stroke, then substance abuse too. So all these psychological and environmental factors can lead to depression. So for the depression basically involves the abnormal activity in brain regions that regulate the mood, the behavior, the appetite and the sleep, especially the limbic system. The limbic system is involved in emotions. Then the prefrontal cortex, which is involved in thinking and decision making. Then the hypothalamic pituitary adrenal axis, which controls stress response. So a reduction in neurotransmitters such as the serotonin, norepinephrine and dopamine is believed to play a major role in causing depression. So for the symptoms vary, but they must persist for at least 2 weeks to meet the criteria of diagnosis, like this person is diagnosed with depression. So emotional symptoms can include persistent sadness, emptiness or hopelessness, then loss of interest or pleasure in activities that were previously enjoyed, then irritability or frustration even over small matters, then feelings of guilt, worthlessness or helplessness, then physical symptoms like fatigue or low energy, sleeping too much or too little, appetite changes like weight loss, weight gain, headaches or body aches with no clear cause, then poor concentration and memory. Then we have the severe symptoms. So severe symptoms like thoughts of death or even suicide, or social withdrawal, and also difficulty functioning in work or school, like you can't do your daily activities. This is when this depression has gotten very severe. So for the diagnosis, depression is diagnosed using clinical interviews, like clinical interviews done by a doctor or a mental health professional. Then standard questionnaires too are done to assess the severity, like the questionnaires, we have this like mood checklist and all those things. Then exclusion of other medical causes such as thyroid disorders or medication side effects. So doctor will check for all these things, and then there will be observation of the behavior and the functioning of the person. So all these things in summary helps to helps doctors to make like the correct diagnosis. Then for the treatment of depression depends on the severity of the depression and the individual's needs. So it often involves a combination of psychotherapy, this is known as talk therapy, so cognitive behavioral therapy, which helps to change the negative thinking pattern of the person, then interpersonal therapy, like which focuses on relationship issues, if the person having issues in relating with their family members or their friends. Then supportive counseling, like giving counseling for encouragement and guidance. Then when it comes to medications, we can give antidepressants, which help to correct the chemical imbalance in the brain that can often be the cause of depression. So examples include fluoxetine, sertraline, amitriptyline, and venlafaxine. So these treatments, they may take 2 to 6 weeks to show their full effect. So it's not something that you see the effect immediately. So it takes time, and they should be continued for at least 6 months after symptoms improve to prevent relapse. So when someone has been diagnosed with this depression, and they go to the doctor prescribes them antidepressants. So the doctor has to tell them that these antidepressants will not work immediately, because most people that have this condition, they're often looking for something that would get them out of this state very quickly. And this information we have to tell them when we're giving them this antidepressants, and they have to continue it for 6 weeks after the improvements to prevent the relapse. Then lifestyle changes to like regular physical activity, because honestly sedentary lifestyle is not good for the brain, it's not good for your body in general. But when you are doing something with your time, when you are up and doing, you find out that you don't even think about these things that you were thinking about before, like all these unnecessary thoughts. So maintaining regular physical activity is good, balanced diet, adequate sleep, reducing alcohol or drug use, and having supportive relationships, because having good people in your life that help you in periods where you don't feel good, it just makes the situation better. Then other therapies that are necessary for severe or resistant cases, there's something called electroconvulsive therapy, but it's done under a specialist care. Then hospitalization for patients with suicidal risk, because people with depression, about let me say 40% of them are always suicidal. So regular monitoring for the antidepressant side effects is necessary, especially in the first few weeks of taking them. Then while taking this medication, it's good to assess for improvements in your mood, in your energy, and in your daily functioning, to know if these medications are working, and if you are also undergoing therapy, if it's also helping you. Then for patients that are undergoing this depression, it's good that they have long-term support from their family, their friends, and also mental health providers. And patients should not stop medication suddenly. Like if they are taking this antidepressants for 6 months, they shouldn't stop it suddenly. They should try to taper the dose, like reducing it slowly, so it's better that way. So in summary, depression is a serious but treatable mental health condition that affects mood, thoughts, and physical well-being, and it is caused by a complex interaction of brain chemistry, life events, and genetics. And early recognition, proper treatment, and ongoing support, they are usually very essential for recovery. So if you know anybody that is showing signs of depression, don't just push the person aside. Sometimes the signs are not even really that clear. Like we should try to, if we have friends, if we have family, so once in a while try to check up on them, because some people may be undergoing silent battles and you won't even know. So thank you for watching this video. I will see you in the next video. Bye.